Today topic of discussion is BMR, basal metabolic rate. What is BMR? Why need to calculate BMR? When we are calculating energy requirement of an individual, three factors are important. Calculating energy requirement, three things are important. What are the three things? Basal metabolic rate. Second one is specific dynamic action of food. Third one is physical activity. Calorie requirement of physical activity. These are the three important things. Whenever we calculate energy requirement of an individual, what are the three things? Basal metabolic rate, specific dynamic action of food, and physical activity. How we will define that BMR? It is a amount of energy required by an individual in awake, not sleeping, awake state at complete physical and mental rest in post-absorptive phase. That means 10 to 12 hours after meal. How we will define? Amount of energy required by an individual in awake, not in sleeping state, at complete physical and mental rest after eating. That means after 10 to 12 hours after meals. Then it required for respiration, circulation, then activity of brain, then ion transport across cell membrane, then reabsorption by renal tubules, then GI motility. What is GI motility? It refers to the movement of food from mouth to mouth through pharynx, esophagus, stomach, small and large intestine, and out of the body. The GI system is responsible for digestive process. Then conduction of nerve impulse. These are so it is important. PMR is important to maintaining internal body organ. Now how it will measure? There are two ways to measure BMR. First one is direct measurement, measuring heat evaluate. Second one is indirect measurement by measuring oxygen consumption. Oxygen measurement, there is one apparatus, name is called as Benedict Roth apparatus. This one is the closed circulate device. This apparatus oxygen consumption is measured per unit time, measuring the oxygen consumption of the patient for 2 to 6 minute period under basal condition. If in 6 minute oxygen consumption is Y liter, while heat generate is equal to 4.8 Y. Y means liter of oxygen consumed. 4.8 liter is calorific value of oxygen. It is calculated by body surface area, which is given by that formula. Body surface area is equal to height and weight. So body surface area, height 0.725, weight 0.45 into surface area 7.18. This is the formula to calculate body surface area. So the normal value of BMR, it is in kilocalorie, KCAL, kilocalorie, or simply in calorie per meter square per hour. In case of male, it is 33 to 38 calorie meter square per hour, or female 32 to 35 calorie meter square per hour. Next, now coming to the factors affecting BMR. There are various factors, example surface area, age, sex, climate, sleep, starvation, effect of hormones, fever, exercise. These are the various factors affecting PMR. So first one is surface area. Taller individual have higher PMR compared to shorter individual. More surface area means more heat loss from the body, which causes the metabolism to speed up in order to maintain body temperature. The surface area increases means BMR increases. That's why in growing children BMR is high and comparing to adult. Second factor, age. Infant and growing children BMR is high and comparing to adult. Age increases, BMR decreased 2% of decay of age. Next one is sex. Male having high PMR because of lean muscle mass, and female adipose tissue is more effective of hormone estrogen is there, so BMR lower. Surface area, age, sex. Next, fourth factor, climate. BMR higher in cold climate compared to warm climate. So cold climate increases PMR rate, then sleep decreases, then starvation up to 50% decreased has been reported. During starvation state 50% BMR decreased. This one reported one. Then hormones like thyroid hormone increases BMR, then epinephrine, cortisol, sex hormones and growth hormones also increase. Next factor, fever. Rising temperature also increases PMR. 1 degree Celsius increases 10 to 12%. So exercise also increasing. Disease status also increases that PMR rate. Infections, leukemia, cardiac failure, hypotension, these are the condition also increasing PMR. Next, what are the clinical significance of calculating BMR? There are two important clinical significance is there. First one is important to calculate calorific requirement of individual and planning of diet. It is important to consider BMR in energy requirement. Second one is assessment of thyroid function. BMR is below normal in starvation, undernutrition and addition disease. These are the condition below. BMR is above normal in fever, diabetic, leukemia. These are the few diseased condition. Thanks for watching.